So good afternoon, guys. Today we have with us Dr. Maulin Shah. Dr. Maulin Shah is a pediatric orthopedic, and in his field is considered to be one of the most successful, sought after, and credible doctors. So usually in a normal course of day, chasing Maulin Bhai is like chasing a ghost because you hardly get any time from him because he is most of the times occupied with his beloved patients. But we are fortunate enough that we have him with ourselves right now. So over to you, Maulin Bhai. First of all, I would like to thank you for joining us today and giving your valuable time to us.
Thank
Uh,
you, Samip.
yeah. So first of all, Dr. Maulin, let us know why you chose to become a doctor.
Yes, so when we were studying, that was an era of 90s. Uh, Two most respected professions were engineering and a medical field. And my parents were quite keen that one of their children should become doctor. And few of my family members also pursued their career as a doctor. And so at that time, to get into a medical profession was our dream. So with me, few of my friends and my cousins, we all were together, and we dreamt together that we'll pursue this career, and that's how we entered into this noble profession. And as we went on the training, I realized that this is such a wonderful profession to have, and we can positively affect life of so many individuals, so many patients. Everyone wants to do philanthropy, and for a doctor to treat their patients in a nice way, to counsel the parents, to reassure them, is in itself is a philanthropy. And being a pediatric orthopedic surgeon, I treat a lot of children, and the blessings we receive from parents is such a wonderful blessing. So I never regret. I would never regret in my life that I've chosen this profession.
Great, sir. Nice. So it also runs in your family, right? Like even your wife, Dr. Shalmi Mehta, is herself is one of the pioneers in pediatric and endocrinology, if I'm not wrong. And so
Yes.
is your sister. Also, interesting fact is that all three of you are kind of related to a common thing that is related to pediatric. So how does it feel having most of your family members involved in this entire one field?
Yeah, it's a nice thing. We did not start as a pediatric super specialist when we met, but this is a journey. This journey started in for me. It started in 1994 when I started pursuing my MBBS and then entered into MS orthopedics. Then finished MS orthopedics in 2003, and then I realized that I love treating children's deformity. And then I pursued a 3 years intensive super specialist training in pediatric orthopedics. So it took 14 long years to finish my training. By that time, few of my engineering colleagues, they already had their families and children, and their businesses were all set. And for us, it was the first step after 14 years. And Shalmi, my wife, is she was a real scholar from her MBBS days, and she always inspired me to pursue a super specialty career. And in the course, we both got great opportunities to learn our subjects from best centers in the world, and that's how we became a unit. And my sister and my sister-in-law, my sister is an homeopath and dietitian, diabetes educator, Dr. Charmi Shah. So she also joined with us. And my sister-in-law is again pediatric endocrinologist, Dr. Ruchi Shah. So it's a coincidence that Gujarat had only two pediatric endocrinologists, earlier on, before few years, still before few years, and both were sisters, and they were working in one premises. So they had contributed to Gujarat endocrine patients, children with endocrine problems to great extent by pioneering their field. Even pediatric orthopedics was also a very rare subspecialty when we started, and now with the grace of God, we have few colleagues, a group of, I mean, a few doctors which are practicing this pediatric orthopedics. So it has been a great journey, and we have enjoyed each day of our practice. And of course, this is a corona-induced breakdown, but I'm sure things will improve and normalize in some future, and we'll start enjoying it again.
Correct. So adding to that, that's why now we have just opened up a state of the art facility and you have shifted to your new premises currently for the same vision that you wanted to help out the children and reach out as much as possible. Right.
Yes. So now, as we started with the smaller premises, and this is the hierarchy of private practice. That as you gain more experience and more practice, you try to switch to a better place. And for last 6 months, we have shifted to a state-of-the-art clinic in near Shamil Charasta, Golden Icon building. And yes, this is one of the best clinics we see in Ahmedabad, and something which we have dreamt for. A lot of people have worked very hard to create this, and this was our dream project. And we are so happy that we are working in a wonderful premises, which is very patient friendly. Even our staff are very happy working in it. Everyone have its own space, and the things which we have observed during our fellowship training abroad, we try to mimic that here and try to give good space to each of the participants, like patients, their family members, practicing doctors, and the staff. Yeah, so we are very happy conducting this practice in this neuro
So
premises.
you also said that you had a chance to gather a lot of information as well as a lot of experience from many other places outside of India. Like I've seen that you have gathered some sort of experience in Toronto, and also you have gathered quite some experience in US itself. So like how would you compare the experience here and over there? And also like how will you compare the healthcare systems over there?
Yeah, so in most of the foreign countries where I've been trained, like in Canada or some parts of Europe and in US, most of the places they have a central health system, and most of the patients are also insured. And compared to that, India has a bit different government health policies. Like Indian health sector can be divided into two parts. One is a government-based health system, and the other is a private-based system. Indian government had given freedom for the private sector because there are a huge number of patients of different strata, of different economic conditions, and private sectors can be again be divided into two or three parts. The first is the corporate sector, which is driven by most of the times by non-medical professionals. The second one is a nursing homes, which is run by doctors themselves. So they carry out the administration at the same time healthcare execution, and the one more sector is trust-based hospitals. So these hospitals are working on very low, no benefit or based practice, where different people give their time, their expertise, and uh, uh, with low cost, or sometimes they do not charge. For example, I'm attached with a foundation in Ahmedabad named as Healthcare Foundation, and I gave my 4 hours free of cost service there. And that's how we cater to a strata of patients which are not very affording. There are moderately affording patients which would like to come and visit a nursing homes. There are some patients who would like to visit the corporate hospitals. These corporate hospitals have provided a good health care, at the same time very good elite services, and they feel like a good star hotels. So uh, there are two main differences. Like government in Western world, when a pandemic or epidemic problems like corona has come, they have converted most of the healthcare system into the COVID care systems. While in India, government sectors have have changed into COVID systems, but it is difficult to apply those things into private sector, mainly because there are two types of services. One is like emergency services, and the second one is essential services. So although COVID is a real pandemic, and we all have to gather our health infrastructure to battle with it. At the same time, there are some domestic emergencies and essential service which will be catered by private hospitals. So during this lockdown has changed the private practice scenario also in India, and we also have we are following our prime minister's verdict of keeping social and physical distancing, and we all have stopped all elective work. We are doing only emergency work, and now doing the emergency work is also not easy because there are lots and lots of guidelines coming up, that how to protect yourself, how to protect your staff, and how to protect your patients. So, and every day those guidelines are changing. So we have to change according to what national guidelines are there, or international guidelines to some extent. We have a lot of webinars we are attending to our own medical associations, and we are trying to safeguard everyone and run a safe practice. Lockdown has helped us a lot in terms of reducing the graph of the COVID infection. At the same time, it has reduced a lot of trauma patients. People are not moving out on the road, and so they are not sustaining fractures or very high velocity traumas. Children are homebound, and so at the same time they are not getting a lot of infections. So those are the two major emergencies in as far as pediatric orthopedics is concerned. One is fractures in children, and other is bone and joint infections. By the grace of God and by the virtue of this lockdown, these entities are reduced, and the traumas are now domestic trauma, which are low velocity trauma, and most of the time we try to treat them without major operative interventions, and that's how the total healthcare has gone down. And it is a time for us to think that how we can prepare ourselves when this lockdown gets over. So
So,
yes, that is
adding to it, often we see that our healthcare is subject to a lot of criticism sometimes. Also, it is also perceived to be quite inferior when we see compare it to developed countries. So, in this state of lockdown, when there is the true test of our healthcare, what do you feel?
yes, I agree with you. And that is also a statement by our own prime minister, that our healthcare system is not as robust, as integrated, and as equipped as the Western world had. And so the prime focus should be on to reduce the quantum of COVID affection. And the best step I think our prime minister took at the outset is to impose a lockdown way early. This was not to reduce the incidence, but to keep ourselves prepared for what we will do, because we can see the worldwide few countries which failed to apply those lockdown well in time, and they failed, and they have miserably high numbers of death rates. Uh, the good thing which has happened due to the early lockdown and a lot of media coverage, that people have turned with disciplined. We can we can deduct few people, those who are not intellectually sound enough to understand the gravity of the problem. Besides that, 80 to 90 percentage of Indian population have started understanding the principles of social distancing, and to avoid crowding, to have best hygiene practice to avoid infection. So our systems are not very solid to deal with this. The number of ventilators we have, or number of healthcare professionals we have. The thing is, it will not be easy. There will be a point where the government-based healthcare providers will get exhausted. We see and we listen nowadays, a lot of health workers are getting COVID infected, and they are required to put into isolation or quarantine. In that situation, the number of healthcare workers will reduce tremendously. To train new health workers to operate those devices like ventilator, or it will be very difficult. And as our system is not a centralized health system, it will also be difficult to drive private practitioners to enter into the government sector to help others. There are some voluntary volunteers who are doing this job. They are getting trained on crash courses or short-term courses, but the speed with which this COVID infection rate increases, it will not be very the number of healthcare workers will gradually go down. So the best practice is still, I feel, even though the lockdown is opened up after 3rd May, we should maintain the same discipline, and we should reduce the going out in community. We should avoid going into community as much as possible, just to move out for the essentials of life, and that's the only way that the Indian healthcare system can deal with this. There's
So
no miracles gonna happen. No miracles.
correct. So when you are talking about essentials, so we can see apart from essential commodity, one thing which is very essential in a day-to-day lives is doctors. Healthcare itself is an essential service right now which needs to be opened. Before there used to be a one-on-one consultation. There used to be a crowding of the patients in a multi-specialty hospital or so. But now obviously things have to be changed or modified, and new systems have to be developed in order to maintain an order. So, what do you feel how the in coming times how the consultation will change for all the patients as well as doctors?
So basically, patients' problems can be divided into three things. The first is an emergency problem, like a fracture or some florid infection or something which needs an urgent attention. The second thing would be an essential thing, because the essential thing means if it has not been treated well in time, that may lead to some problems or sometimes a long-standing problem for that patient. And the third will be elective problem, like the problems with which the patients can live for some time, and it is not urgent to see a doctor for that. So we have to segregate them into three such situations. Of course, the emergency patients would come to your nursing home or your hospitals, and you have to equip your staff members and yourself to deal with them with all the these protection gears. When it comes to essential service, now we have adopted a telemedicine service.
Okay.
So there are a lot of applications available, and the patients, they book an appointment through the telemedicine interface. They do payment. Now everyone, all the patients are well aware of e-payment mode, like there are PayZapp and Google Pay and Beam Pay, and
ATM
so
and
if you share your QR code, they can easily make that payment. And once they do that payment, they get enrolled for an tele consultation service. And we on that app interface, we come to know that this patient with this number, they want to do a consultation at this particular time,
okay.
and we call them, and we try to listen to their complaints. We try to bring out some important examination points, and we give them proper advice that what can be done. Now there are we were worried at the outset that how the system would work, like whether the patients will be able to do payments or not, or whether our advice would be uh, would be satisfactory to them or not, or whether we will be able to do a proper clinical examination to come to some conclusions or not. But what I have found that this kind of telecommunication helps in few ways. First and foremost is the parents of these patients are extremely apprehensive, and once we see them and once we advise them, we can calm them down that you don't need to panic, and your child's problem is not the one which needs a real urgent attention, and this can be corrected once this lockdown phase gets off. That's one thing. Secondly, when we start doing some giving some advice which parents have to follow at home, they feel that they are contributing to their child's health. So that's one more good part. Some parents have a guilt in their mind that because of this lockdown and we are not taking enough risk to visit hospitals, and are we doing some wrong to uh, our children. So that guilt get over, and by doing this telemedicine thing, we are following the one of the best practice. Like we are encouraging lockdown, we are maintaining the social distancing, and with our experience, we definitely know that this child needs an urgent attention. So in my practice, we about 70% patients come visit us from out of Ahmedabad. So we try to communicate with our friends in that particular area and to give them primary care. And if things are real urgent and that needs a very special attention by me, then I would draft a letter to the local authorities to allow them to travel. And based on that, they sometimes give some passes to our patients. So based on those letters, they can travel.
So
So telemedicine reduces the overwhelming number of patients uh, that will help us once we start our practice again. We used to see around 30 patients a day, and once the lockdown gets over, if we have 40 patients in our clinic, then we will be severely disturbing this social distancing and all those. In our practice, we used to consult patients only after appointments, but as you mentioned, many doctors, they treat them as they come, the first come first basis. But now the patient should also understand the scenario, and they have started understanding this. They are taking appointments, they don't mind taking appointments, and they are already, they would come to your premises at particular time, because we now inform them that there should be only one person with the patient, there should not be overcrowding, they should wear appropriate protective gear, so they should have masks on. And once they'll come to our clinic, we will provide them further protective gears like shields and disposable gloves. They do not have to bring the files, because that files are they can be a carriers of this. They have to do payments as far as possible through cards. The physical currency can also become a source of infection. In the clinic, when they come, we have designated place for them to sit, so they are distant from other patients. In our OPD setups, we have removed the chairs which is lying in front of our desk, but there are some sofas which are at about 3 meters distance from doctor's chamber. The doctor's consulting rooms are open so that it does not become a closed premises. Uh, we check them with a digital thermometer. So we are going to take all the precautions, and the patients should also understand this the discipline, not only in the medical field, but also when they go out to do groceries. I was just seeing an interview of a Swedish person. So although Sweden has very less population, but Europe is very highly affected, and everything is open in Sweden because the population is highly educated, and they are keeping social distancing and hand hygiene as only two protocol. And compared to Europe, the rate of corona affection is way less in Sweden. So I also feel that if patients also understand this discipline and visit hospitals or other any other premises, will be able to reduce the affection by corona.
There are a lot of improvisation in the way pharmacies are being delivered. There are many apps like PharmEasy. There are like apps like 1mg. So what do you feel is the next wave, or where do you feel that entrepreneurs can identify particular gap in healthcare?
Yeah, the first and foremost thing is we all should understand that these things are not going to change dramatically in very recent future. So when I'm telling you this, I feel that our ability to move around freely, as we were doing in February 2020, will not be possible until 2021. So this is the period of 6 months where we have to do a lot of innovations to uh, to uh, give the proper health care or proper infrastructure. And there is a lot of opportunities for the new or the technical people, uh, just like this telemedicine apps. There are a lot of apps available. They are trying to make this platform very
The appointment based thing,
very
a smooth interface.
user friendly, and they are doing a lot of innovations. They are There are opportunity to conduct smart OPDs. We were seeing an interview. Smart OPDs, how physicians can carry out. They have a pulse oximeter in a separate room, so patient can apply. Uh, the patient can apply a pulse oximeter in their hand, and the doctor can see from distance that what is their pulse and oxygen saturation. They have patient himself can apply a digital thermometer, and whether the patient is having fever or not, they can understand. They have even digital stethoscope. So a Bluetooth device, doctors can see in their mobile that what the patient's heartbeats are. And so these are the ways the young entrepreneurs or young technical people can uh, contribute to a smart clinic practice. Of course, when it comes to real emergency practice, now there are some uh, technologic people in, like, for example, the one in Bhavnagar and the other one is a GG hospital in Jamnagar. So they came up with their own PP kits and N95 masks. So they, with some inventions, they made a cost-effective mask and PP gears, which were circulated through medical association to a lot of doctors across. So that's one more place where the inventions can take place, and a low cost protective gears for not only for doctors but also for patients can be developed and sold. The OPD devices, as I mentioned. And yes, say we see a lot of crowding at the Apollo pharmacy, for instance, or different pharmacies. So there should be something where the medicines can be delivered with a very safe way. And we all know that some basic practices will help us, like whenever you bring something from the market, you don't touch it right away. You keep it in a separate box. Don't touch it for 24 hours. Or if you need them, then you just wipe it with an alcohol based sanitizer and then use it. You bring some fruits or vegetables, you pour it in a bucket, and then some water, and then some people are using some caustic
I guess
soap
I
or
agree to
something.
you very much that bringing out cost-effective solutions is the need of the hour, because many things are not affordable to the audience at large. One of the big advantages of being an Indian, because a word jugaad is always associated with an Indian.
So I mean, jugaad is a domestic word, but if you see, the people are using their intellect and available information to do an alternate measure. Like in the Western world, when there are a lot of resources, they can use their protective gears. Once they use, they throw it away. But it is an Indian perspective that how to reuse N95 masks. And once they came up with some strategies, the Europeans also shortly got exhausted in their N95 masks, and they started using Indian philosophy to how to reuse them, how to put them in. There are two ways available how to reuse it. And so there are some, uh, as we saw that Narendra Modi today in this Man Ki Baat, he said this is a people-driven movement. So we all have to do some innovations to be safe, and we all have to become what's known as COVID warriors. So they now there are our technology or IT guys. They have come up with so many good applications like Arogya Setu is one of them, and now there is one more covidwarrior.in. So we all can be part of that and know what latest things going on, and we Indians will come out as I recently heard Dr. Tejas Patel's interview. He also mentioned that just like Japan, which came out of the atomic warfare, and each and every person in Japan came up with a great work. Similarly, am very hopeful that India would also come up and come out as a winner in time. This is an opportunity actually to outshine, and we should not just wear the mask of whatever things the Western world has given. It is a time to understand that we have our own capabilities, and we should modify things based on our own requirement. And India will do well, hopefully.
I guess that's a very positive thing you said. So now let's jump to the last section of our thing. So let's talk about Dr. Molin as a person. So let us know the first three things that you are doing right now that makes you keep occupied.
Uh, the first thing is um, I spare time to write some research papers. Like we have published few papers, and then we had few innovative techniques, and I did not get time in my busy practice, so I'm working on that. That is the first thing. The second thing is I write poetry,
Okay.
and of course it was a dream for a long time to compile those poetry in a book. So um, I'm trying to do that. The third thing is I was always devoid of spending good quality time with children and with family, and that's what probably I'm doing right now.
Okay.
And it is difficult to imagine how will be the time after lockdown, where children are so much now accustomed to me be at home. So this three things I'm doing. I've also spent some time in teaching people across India by doing some webinars and some activities on WhatsApp groups. So this things, but what I have found that I don't get time because all the household helps are gone, and we all are busy doing homework work. We are helping our wives and dealing with kids and keeping them busy. So I don't get actual time which I expected. So I cut short my sleep hours to write some poetry or to write up some paper. But yeah, this is a wonderful time we can spend with family. I am like just like me, everyone would have elderly parents, and in our busy days we could hardly spare few minutes with them, and now we can sit with them, uh, and we can play different games. So I'm sure that this time will be cherished for long, whenever we are telling these stories to our children or and grandchildren in future.
Okay. So Molin bhai, last but not the least, just a small positive word for the people during lockdown.
And so each difficult time actually is a time of an opportunity. So we all are going through a difficult time, and it has actually, if we take in other words, or we what Bill Gates said, that this is the time where we should re-travel the human values, the values of love, values to be together. So that's and the thing that the material world had blindfolded us, the principle which Gandhiji narrated of aparigraha, that we now knew that with the minimum things we can live happily with our family members. And so this all things are learned during this time. The more the time of lockdown, you will become more and more spiritual, I hope that with this short span, people have understood those principles. It has also taught us to value people like the policemen or like the healthcare workers or like the people who are cleaning our societies. Those people are working as warriors on the front line, so we should respect them. We were not respecting policemen, but now when we see policemen, it will feel that they are respected colleagues. I feel that when the doctors are moving across, they are also having a very high note for them. So these things which were existing in Indian culture way back, now it is coming back, and hopefully this will be properly on all across the globe. So I feel that uh, India will show path to the world, and we would emerge again after some time as a world booming economy. So I appeal to all for those who are attending this webinar that we should not get disheartened. There's an opportunity to bounce back, and we surely will come out as winners. I have full faith in it. So let's just maintain and follow protocols given by our central government and prime minister. Social distancing, personal hygiene, and in few months we will conquer this virus.
Great.
So
So,
thank you very much.
so thank you very much, Maulin sir. That was a very great positive speech, along with some very valuable insights that we got to know from you. So thank you for joining us, and thank you for all the participants to spare your valuable time with us. Thanks a lot, sir. Thank you.
Thank you very much. Take care.